International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Hello, my name is Graham Martin. I'm Professor of Health Organisation and Policy at the University of Leicester in the Social Science Applied to Healthcare Improvement Research Group. And this is my colleague Pam Carter, who's a research fellow in the same group. We're going to just say a few words about our recently published debate article in the International Journal of Health Policy and Management, which is called Challenges for Healthwatch, a New Consumer Champion in England. So Healthwatch is a collection of bodies around the country, 152 of them in all, plus an umbrella organisation called Healthwatch England. So each of the local Healthwatch organisations is responsible for various things, including scrutinising local health and social care services for adults and children, providing information to patients and carers about the health and social care services available to them, and advocating on behalf of the public and patients and carers back to the providers and commissioners of health and social care services about what the patients and the public want from those services. So we've done a very preliminary analysis of our data, and we've been talking to various people involved in the Healthwatch system, and that gave rise to what we present in this paper, which is 4 challenges and tensions that we feel face Healthwatch, and which we thought would be useful to share to inform future Healthwatch practice, to inform policy, and to contribute to the international academic picture. So Pam's going to talk about the first 2 of those challenges, and then I'm going to talk about the second 2.
The first challenge that we set out in the paper is that of jurisdictional integrity. So we made an assumption when we started with the study that Healthwatch's role on the Health and Wellbeing Board was important. They have a statutory right to sit on that body, and that body is part of the local authority, which has a defined geographic boundary. Now, what quickly became clear was that boundaries are far from clear. In fact, they're quite messy, and Healthwatch are sometimes having to work across different boundaries. And in fact, the Health and Wellbeing Board is not necessarily where the major decisions are actually taking place. It may well be the place where plans get signed off, if you like, ratified or rubber stamped. But increasingly with health and social care, we're seeing big transformation plans that cut across various local authority boundaries, and so we feel that this gives rise to several challenges, well, that in particular of jurisdiction integrity for Healthwatch. The second challenge that we outline is that of whether Healthwatch has a USP. By that we're referring to a unique selling point, and we're deliberately using market terminology there because it seems that there is an increasing marketplace for patient and public opinion. So although Healthwatch has got this statutory function, there are many and varied ways in which local patients, carers and members of the public can express their views. And we draw on the work of Deborah Lupton, who's done work on the commodification of patient opinion, to show that there does seem to be a marketplace, so that Healthwatch won't necessarily have that unique credibility in the eyes of the local population as the main place to go to forward views and express opinions.
The third challenge that we talk about in the paper is around resource dependency. Now, each local Healthwatch organisation is commissioned by local government, by the local authority for the area. But of course, those local authorities are also responsible for commissioning or providing social care provision in their area. And that, of course, creates something of a conflict of interest, because the very organisation that's commissioning a local Healthwatch organisation is also expected to be held to account by the local Healthwatch organisation for the quality of services it provides or commissions. So several of our participants did talk about this potential conflict of interest. They didn't identify any major scandals or anything like that, but they did say that they had to be careful about how they raised issues with their local authorities, because they were very conscious that those local authorities held the purse strings. The money that comes from central government to local governments for commissioning Healthwatch services isn't ring-fenced, so it's up to a local authority how much or how little money within reason it uses for the local Healthwatch, and several local Healthwatch budgets have been squeezed. So this was a real concern for our local Healthwatch officers, who just had to be slightly guarded in terms of how they went about raising issues, how they engaged with that major contributor to their funding. The fourth and final challenge we identify in the paper is around the role for Healthwatch in the major changes to health and social care services that are ongoing in England at the moment. So in common with many other countries, England is facing real challenges in terms of its health and social care provision. Funding is more or less static, but demand is rising sharply, and funding for social care indeed is declining. And because of the changes in the demographics of the population, because people are getting more complex conditions and comorbidities, the demands on NHS services are increasing. And what that means, of course, in order to sustain good quality NHS services, is that NHS and social care organisations are being asked to make major changes, transformational changes to the way they provide health and social care. Now, for Healthwatch, that presents a challenge because, on the one hand, they might want to be right at the centre of those conversations, contributing to them very actively, ensuring that patients' and the public's views are having a real impact on the decisions that are being made. On the other hand, they might be safer keeping a slightly critical distance so that they're not too immersed and incorporated into these discussions as they're ongoing, so that they can maintain their independence. And that, we found, was a real quandary for these Healthwatch organisations. They didn't want to be too critical, but they didn't want to be too friendly. So the critical friend role that was set out for them by government was a really difficult one to fulfil in a way that was autonomous but influential. So those are the four challenges that we've identified. Hopefully they'll be of use to policymakers, to Healthwatch themselves, and they'll have some resonance with the international scene. And from here on in, we'll be proceeding with our empirical analysis, and we hope to be able to report back on that in a year or two's time. So thank you very much for listening. We hope you enjoy the paper.